So Sam was a full-term baby. At a year old, I started seeing a few differences, but I didn't realize how concerned I should be, given that I didn't have a lot of knowledge of typical development, being a young mom, staying home with my children, and I didn't have a lot of kid experience.
1 out of every 4 young children is at moderate or high risk for developmental, behavioral, or social delay. Research shows that the earlier these delays are identified and children receive services, the better the outcome. This is particularly true of children in low-income families, such as those served by WIC. These children often miss out on critical services at a time when those interventions would have had the greatest effect on their quality of life.
The Developmental Milestones program gives WIC staff a reliable, professional tool to use with parents to monitor their children's development. And it does this in a positive, supportive way that engages parents and encourages them to take an active role in their children's developmental journey. It can be linked to nutrition education, referrals, and participant-centered goals when appropriate.
The WIC program and the Developmental Milestone program are perfect partners because the main focus for the WIC program is for healthy children, to give children a healthy start in life.
We lost out on 2 years of early intervention and access to services. It was just because I wasn't informed.
WIC staff may be among the first to observe these possible developmental concerns and refer for further assessment. Almost 100% of WIC staff said that parents were willing to complete the checklist, and nearly all parents reported that they learned new information about their children's development. WIC staff members indicated the program was easy to implement, with 80% reporting that the program takes 5 minutes or less. In fact, some staff reported that when parents completed the checklist during data entry and no referral was needed, the program added virtually no time to the appointment.
The clients that we have here were really open, first of all, to always fill out the checklist, which was great. And then anytime that we did have anyone have a referral and we followed up with them about it, almost all of them actually, the doctors were proactive about getting them into different services. That has been awesome.
Almost 100% of WIC staff said they referred 1 or more children. 90% said the program helped them learn when to refer and how to support parents through the referral process. Most importantly, the program helps children get the services they need.
For myself, I have a 9-month-old, and so I'm constantly checking out these checklists to see how he's doing. So both ways, personally and then professionally, it's been, I think, amazing.
Using materials developed by experts at the Centers for Disease Control and Prevention, the WIC Developmental Milestones program is focused on children, meaningful to parents, and easy for staff.
One thing that I've really come to realize is knowledge is power. And when you inform parents, then they have the ability to be a good advocate for their child and to help guide their children to reach their greatest potential.